Good afternoon or good evening, depending on your time zone. Today we are going to finish up the bleeding disorder by talking about thrombocytopenia in pregnancy. And this was asked by a patient of mine regarding why her platelets were low. She came to me in consultation. So let's start by defining what is low platelet. Platelets are usually between 150,000 to 400,000 platelets per microliter. So when we have a patient or a woman who's pregnant, if her platelets are under 150,000, it begs to identify to see if this may be a potential source of problems. So what are the sources of the problems? Well, there's an increased risk of preeclampsia or HELLP syndrome, or maybe there's an autoimmune disorder like immune thrombocytopenia purpura, lovingly called as ITP. This can pose risk for mom. So how do we manage and monitor it? Looking at how the platelet counts are trending is going to be very crucial during the pregnancy, especially if thrombocytopenia is detected. The management, of course, will depend on the underlying cause or the severity of the condition. I'm not going to go into the treatments because the treatments are going to differ according to what the underlying problem is. As we know, there are potential complications for mother in pregnancy because the platelets form an important plug in the blood vessels to prevent bleeding. So there's an increased risk of bleeding if those plugs are low in count. It may also affect how you deliver and when you deliver. So these are issues to be addressed. So what are the tips? The platelet count is an important lab to be done in the first prenatal visit, which is why we encourage early prenatal care. If it is identified that the platelet is under 150, then number two, if you have a lab that was done when you were not pregnant, that would be a useful piece of information to share with your doctor. So if you had a platelet count done prior to the pregnancy, finding that information and sharing that information will give us a very vital insight as to what may be the cause of the thrombocytopenia. Number three, a consultation with a maternal fetal specialist would be the next best step. And depending on the findings, the MFM may refer you to a hematologist. So that's my little tip for today. We're in the midway week. I want you to walk good and don't forget to breathe. I'll talk to you soon.